Hello friends, welcome to Dental Excellence Academy. Once again, we are planning an implant in the region of lower right mandibular region, that is 4-5. We have a good amount of bone and height here also. So we will be planning it digitally. So beforehand, we have taken a CBCT and we have planned the implant. You can see implant. It is in the center of the bone, a good amount of bone on buccal and lingual side. So now I'm starting with the crestal incision. So as we have the mental foramina just below the surgical site, so I'm not going to give vertical incision. With the help of sulcular incision and crestal incision, I'm going to reflect the flaps. So with a sharp, a good quality periosteal elevator, now I'm reflecting the buccal flap. In same way, I'm going to reflect the lingual flap also. So now we will be starting with the lancet drill. Just see clinically you are going parallel and you are going exactly in the middle so that your prosthesis will be in a good position. So you have to your base of the handpiece should be parallel to the occlusal plane. Follow this simple funda. Base of the handpiece parallel to the adjacent occlusal plane. This is the funda you have to use while drilling. But sometime bone might be having concavity. In that case, you have to change the direction. But if you have a straight bone, so just follow this simple funda. Now I'm going with the 2 mm drill. Here also my handpiece is getting stuck to the adjacent tooth, but I'm going quite deeper, that is 10 mm. So I'm not using the drill extender. With the help of the same drill, I'm going to take one X-ray so that we can check the parallelism. It is quite parallel, but we have not achieved the length. So I'm going deeper with the same drill. So this is 4 mm drill. Now I'm placing the implant. This is iFix 4 by 10 implant. So iFix K series. It is Korean compatible. So they had given the name iFix K series. They have other series also, that is Israel compatible, and they have their own design. So I'm using the dentium kit for this because I'm having the dentium kit. I don't have iFix kit with me, so I'm using the dentium kit. So I'm getting good amount of torque, but at this point I got stuck and my implant is not going inside. So I think I have to remove the implant. So now I'm going to remove the implant. Sometime if we forcefully place the implant, it is very difficult to remove also. In that case, you have to drill the bone around it and you have to remove the implant. So don't go beyond the limits. Uh, the o-ring of this driver is worn off, so my implant is slipping. So I think I have to use a tweezer to remove the implant. So I'll try with the driver. No, it is not coming out. the O-ring has got worn off. So I'm using my tweezer. So your tweezer should be highly sterile. So now I'm going deeper. So I have to change the direction so that I can go deeper. And in this implant, you have to use countersink, and that I have not used previously. So now I'm using countersink. But due to small height, I have to use the drill extender. Now it's done with the countersink. Now I'm placing my implant. I think now I will be able to go to the desired length. So I'm planning to go 1 mm subcrestally. So right now I'm using my ratchet so that I can check the torque. But due to improper positioning of my camera, I will not be able to show you exact how much torque I'm getting. But I'll tell you that I got 35 to 40 NCM of torque in this case. So when you get good amount of torque, you can place a healing abutment directly so that you can avoid the second stage surgery. So check whether you are below the crest. Otherwise, you have to give one or two turn. Now I am placing my healing abutment. Sorry for the improper positioning of the camera, but these are my initial videos. So day by day I'm getting better. So in upcoming videos I will be good at my videos. So can you see the parallelism clinically? It is parallel to both the teeth. Now we have to check it radiographically also, and it is quite parallel to both the teeth. So in OPG also you can check the parallelism. Now this is a condition after 2 months, and we have replaced this thing with the PFM crown, screw retained PFM crown. Thank you for watching.